Welcome back to News Talk for this half hour. I'm joined by Kim Thompson, a nutritionist, who's here to talk about, among other things, your health and nutrition. And we're going to start out talking about functional medicine, which is a term you're hearing a lot lately, you said.
Yes. Actually, about a week ago, Dr. Oz finally brought this the attention that I think it deserves. And what I really like is that he introduced to his audience the fact that people always ask him, where are you going to send your family members to? And it was what he called the Fabulous Four of Functional Medicine. And so really what functional medicine is, they call it a new science, but it's been around forever. The term is about 25 years old, but it's really getting to the root of problems and understanding what's going on in the body as a whole, rather than just looking at symptoms and going to, as I call it, cover up symptoms or attempt to just treat symptoms. So functional medicine is really digging in really deep and understanding that the body is interconnected.
And focusing on prevention and overall health as opposed to just treating a symptom, which isn't actually the cause.
So one of the neat things about functional medicine is looking at all of the, like I said, the various connections, but how instead of waiting for a disease to happen, on that preventative side, so for instance with diabetes, there's signs and symptoms beforehand. It might be a little weight gain, it might be elevated blood sugar, but not abnormal. So functional medicine really looks at treating it and looking at it from that standpoint on what can you do before the diagnosis so we don't actually have to get there.
That's great. So preventative measures to
absolutely.
We've got a caller on the line, 793 WKTV, if you've got a question about health and nutrition. Hello, you're on the air with Kim Thompson.
Hi, I'm an uncontrolled diabetic. Actually, I see an endocrinologist, and we're talking, a lot about carbs. And I wanted to know, because it seems like you have to eat an awful small amount, because if I eat just like one extra any carb, my blood sugar is really raised high. Why is that? Could you tell me?
Well, it could be a few different things. Carbs, I think, in general have a misunderstanding. Carbs do include fruits and vegetables and whole grains. So depending on the carb that you're taking in will depend on what it's going to do to your blood sugar. If you're eating carbs in the sense of whole vegetables, chances are it's not going to interrupt that stream so much, and you're not going to see your numbers jump all over the place. The other thing to keep in mind too is that what is the time frame in between when you had your last meal? For diabetics, really for everybody, but for diabetics in particular, you should be making sure that you're eating something every 2 to 3 hours to help maintain a good, stable blood sugar level.
Do we have another caller on the line? Nope, no other callers on the line. Well, earlier in the broadcast, we saw the piece from a reporter about more people turning to honey to use as a medicine for children who are between the ages of like 1 and 6. Are you seeing more, people turning to those kind of everyday ingredients that have been around this long? I
personally see it all the time. People are really looking for these alternatives. I think there's a lot of people who are frustrated, to say the least, with having to think about taking another prescription, and they really don't want to go and take another cold medicine. They don't want to feel those crazy side effects that are starting to happen. So we're kind of going back to the root of things, is what I'm seeing. We're going back to how we originally should be caring for ourselves, which is through food. And I think we've probably all used honey at some point. When we have a cold, we put it in some tea, and there's a reason why we do that. It actually does soothe the throat.
And it's not like this is some kind of new discovery. These are things that have lasted the test of time and been around. Like, I believe that one said the ancient Egyptians were using it. So that's, time-tested, proven methods. In this cold weather, obviously people are going to be, fighting the sniffles and the sneezes. Any healthy, natural tips as we head into the cold season?
Well, obviously we want to make sure that we're keeping ourselves clean and healthy, but think about your fruits and vegetables.
All right.
Load up on them.
Excellent. Kim Thompson, thank you very much.
Thank you.
We're back after this.